Hey, it's Lisa Marie from Cars 108 at Hurley Medical Center, and we are talking stroke prevention. I'm with neurologist Dr. Mohammed Al-Kazmi. Thank you so much for visiting with me today.
Thank you.
I'm going to cut right to it. Strokes do not discriminate based on age, gender, race, or anything like that. True?
That's correct. So any person can have a stroke. As a matter of fact, in the United States, every 45 seconds somebody has a stroke. Every 3 minutes somebody dies from a stroke. So it's rather common, and it does not discriminate. Any person is at risk of stroke. Granted, older population are at more risk, but any person usually is potentially at risk of stroke.
With statistics that high, it is so important to know the warning signs because time is of the essence when a stroke is occurring. What are those top warning signs an individual has to be aware of?
So I want you to remember to be fast, okay?
Be fast. Be fast, okay.
So B is for balance, E is for eyes, vision.
Okay.
F is for face, facial droop.
Okay.
A is for arm weakness. S is for speech, and T is for time. And time is two things: the time of onset, what time the symptoms started, and time is of an essence. So immediately, if you recognize any of those symptoms, go to the nearest emergency department.
Now, I've heard of early warning signs of mini strokes, TIAs they call them. What are some symptoms of that may indicate that somebody is prone to having a stroke?
So again, similar symptoms: facial droop, speech problems, memory problems, visual problems, walking problems, imbalance. All of those are also the exact same symptoms of stroke. The only difference between TIA and stroke is there is damage in the brain, okay? With TIA, this is a golden opportunity where we can do things to prevent it from happening again because people are back to their normal selves.
Now, people will want to know, is there something they can do to prevent a stroke? I know some people may be prone to them due to medical conditions, but is there something they can do to maybe ward off having a stroke?
So yes, there is what we call preventative things we can do, so modifiable risk factors versus unmodifiable risk factors. The number one modifiable risk factor for stroke is actually hypertension, high blood pressure. So any person has high blood pressure, we need to be very aggressive controlling their blood pressure. Diabetes, sugar, controlling the sugar in a very tight manner. Also sedentary life, so we have to be careful with what kind of food we choose to eat. Exercise. We know for a fact that people who exercise regularly, the risk for stroke, heart attack is much less than those who do not.
Doctor, thank you so much for taking time with us
Thank
today.
you so much. Have a great day and be safe.
I'm Lisa Marie from Cars 108.